Hi, everybody. Welcome back to the PSW Podcast. I'm here today with Harv and David, who are from Pillway today, and they're going to give us a bit of a look into what Pillway is, the resources out there available, and maybe how it got started as well. So I'll hand it over to you, David, just to kind of tell us a little bit about the background of it from the home care perspective, as we just spoke about beforehand. So thanks for coming on.
Yeah, thanks for having us. So Pillway is a lot bigger than just home care, but specifically when we're talking about the home care aspect, what we've done is on top of our industry-leading chronic med management platform, we have built in caregiving tools. So everyone knows that demand for home care and caregiving is rising in Canada. Ontario itself has seen a 20% rise in demand since 2010. And the issue is there's a shortage in workers, and the workers who are servicing these clients, there's a lot of, I don't want to say issues necessarily, but there's things that can be made better. Healthcare, especially when it surrounds the elderly and caregiving, is one of the last things to really be innovated. And that is why we built some of these tools to assist in some of those things. So as everyone knows, one of the most notorious issues is burnout. 50% of PSWs in the healthcare sector stay for fewer than 5 years, and 43% list burnout as one of the primary factors for leaving. And this is something that you can see not just in Ontario, you can see it across the board and all over Canada. And so, tech like our app with the caregiver tools built in can help. And how? So we automate things like renewals and medication reminders. That gives us a 100% fulfillment rate when those things are taken into account. We have remote monitoring for medical adherence. So that allows the caregiver to see if patients are actually following the health plans from afar. We, of course, have our great multiple patient profile so that as a caregiver, if you have 10 or 15 different patients, you can list them in your own profile as sort of sub profiles and become the main point of contact for those people. This makes managing paperwork and all of the inefficient tasks way more efficient and organized. And then on top of all of that, our wonderful pharmacy care team is around at all times to answer any questions that you may have about medications or care of anything of that nature. So the idea here is to really provide a robust support system for the caregiver themselves, which is the main thing that we've seen to be lacking across the country.
Definitely. And just from my perspective as a caregiver, it's been very hard to get medications in general without, the breakdown in communication that I know you and I have talked about before. So hearing that this app was coming out was kind of a mind-blowing thing for me because one, I've never heard of it. And two, it really does take out sort of the middleman where communication gets lost, your prescriptions get mixed up, all of that other stuff. And it just seemed really easy to digest on the phone for someone who wouldn't be new with technology or would be new with technology. So it's very exciting. And maybe Harv, could you kind of talk a little bit from your perspective, from the patient's perspective?
Definitely.
Great.
Yeah, definitely. Like David mentioned, thanks for having us on. So just a little bit about Pillway. So I've been with Pillway since the beginning, one of the co-founders. And similar to what you see with PSW, within that industry, within pharmacy, there hasn't been too much innovation either. So we've seen everything from e-commerce to even just communication tools like Zoom kind of blossom in the last little while, especially with COVID. But pharmacies kind of lagged behind when it comes to digital innovation. So that was what kind of led us to launch this. It's an idea that we actually pitched to some of the bigger players in the space, but they, their timelines for getting it out, they're kind of stuck in their way, and what's working, why fix it? So what we thought, why not build it out ourselves? So it is essentially having a digital pharmacy. So rather than you going to the pharmacy, we bring the pharmacy experience to you. So David alluded to some of the tools and resources that we do offer, but essentially it's from end-to-end care. So you being able to talk with the pharmacist, being able to order your medications, like David mentions, there's refill reminders, automatic renewals. We're continually reaching out to anybody that's in your circle of care to make sure everyone's on the same page. And then also what applies, especially in the case, like you mentioned, for PSWs, you can have multiple profiles. So, it's easier to manage. You can have it's almost like an electronic locker. So you can add appointments on there as well. You can add tasks that are related. And the app itself will prompt you with that. And one of the tools that's probably the most used is just the chat function, just being able to send a message to your pharmacist, whether you're here, whether you can be around the world and send a message, and you're connected to the pharmacy team. So there's no concern about you missing any sort of information or not getting your medications. In addition to that, there's just simple tools that we offer. Like David mentioned, we really kind of focus in on disease management. And some of those tools it's even as simple as you might say, you know what, the doctor writes your prescription, but you just fill it and take it. It doesn't work like that. So anyone who's been in the industry knows that doctor can write you a prescription, but that prescription being translated to the patient actually taking the medication as prescribed, there's a lot of hurdles. Number one, you got to take it to a pharmacy. You have to get it filled. And then when you get it filled, you have to remember to take it. And then when you have refills, you got to remember to book an appointment or call the pharmacy. So there's a lot of steps that kind of minimize or not minimize, prevent patients from being fully compliant with their medication. So we offer tools like we synchronize their medication, so they're all running out together. Any changes, we clearly communicate with you. We can pre-sort them into very easy to open packets, which are really beneficial for seniors as well, because they're not the traditional blister packs that you're popping out. They're very easy to open. So, anyone struggling with arthritis or just even issues reading, it's very bold writing. So it really helps kind of see what you're taking. You get automatic reminders on it when you're on the platform. You get automatic reminders when you're due for refills, or if we fax your doctor. It's almost like having an assistant work alongside you. And I know as a PSW worker, I've talked to a few myself, it definitely becomes cumbersome. So I feel like any tool within healthcare will be really, really beneficial for both the patient as well as the caregiver.
I'm listening to this as a PSW and I'm thinking, how many times have I had someone fiddling with their pill packages and they do have arthritis in their hands and they can't open their medications. So, they wait till you come and you can open their pills for you or something like that, or even just dosaging, like in home care as well. Sometimes we help with administration, and there's been probably some sketchy moments for everybody where you're wondering, is this like an accurate prescription? Is this new? Is this current? Is this something that we should be looking at again? So knowing that it's being monitored online all of the time and you could have access to it as well to kind of see, okay, like everything is fine. This is the correct dose. This is current. We're good. It's different than just finding the pill bottle, pill label and looking it up yourself. So that was really cool to hear that. And those little things too about making the pill accessible to people, just the packaging itself. And I also saw too, I browsed your website and I saw a lot of different resources for different illnesses or ailments like mental health, pain management as well. And I know, David, you touched on this with our past meeting, looking at pain management and working with, your team on alternatives aside from, opioids or other things like that. And I thought, wow, that's really special that you're looking at disease or ailments specifically and offering alternatives, because we all know that in past times in history that opioids were pretty much the way to go sometimes for some people. So that's really incredible too. And could you just touch a little bit more on that as well? Like what inspired you to put that on your website? I think that that's very special.
Yeah, Harv's probably better to handle that one.
Yeah, so we focused in on a couple of chronic disease states that we feel are common with a lot of our patients that we see. So just to kind of own in and address those a little bit more specifically. So providing resources such as even just access to information, being able to read stuff on it. Patients that are on pain medications, we definitely do an intervention. With all of our chronic disease patients, what we try to do is a review of their medications so that they know why they're taking it, and we try to reassess their indication as well. Yes, you were put on this medication. It might have been put on it 5 years ago, but no one's ever kind of followed up on that. And that was a large thing with a lot of medications that we see, within pain as well. Like, you might have been given something, for a flare-up that might have happened, but it's never been reassessed. Did you really require it? And I'm sure as well, there's a very slippery slope when it comes to narcotics, right? So any opioid medication, once you start taking it, it's really hard to come off of it. You build tolerance, you need more and more of it. So, just having that assessment, letting them know non-pharmacological things are important as well, right? Whether, whether you're stretching, yoga, there's other, like alternative medicine that the patients can employ as well. And, we'll help them coordinate and provide resources. So we're always kind of growing our network and seeing who else is out there in the space. that wants to take on the responsibility of educating patients, and you're just offering more resources at the end of the day. I think the more and more tools you put in the hands of your patients, the more likely they are to succeed. And especially like in your case, if you're a support worker, if you get familiar with one of the resources or pain management, you can apply that literally across the board, right? With all your patients.
Yeah, no, I think it's wonderful. And it's very neat to see a pharmaceutical brand look at other things and other alternatives, like, exercise and all of this other stuff that, again, before was almost non-existent, or you were almost pushed to take something instead. And it's really neat to kind of see like a little bit more of a holistic approach, if that's the correct word to use for this, but it's very neat. That really blew my mind a little bit with website in and of itself. I was like, wait a second. So that's really cool. And I also liked as well, for people that aren't very familiar with their phones or with apps, there's a phone number online and you can just call someone in. So if someone was using the website or using the app and they were unable to navigate something, there is sort of a line that you can go to and have someone talk you through some things, right? I read that correctly, right?
Yeah, you read that correctly. Yeah. Just to go back on what you said earlier, I think the term holistic is thrown out there a lot. It's kind of a popular term, but I personally believe it as well. And a lot of times I reference the analogy that, it's like a tool belt. The more and more things you have at your disposal, the more likely you are to succeed. So medication is definitely important. It's not the only thing. You have to have other modalities and other resources and tools at your disposal as well. Just to touch base on the question you're asking now, any sort of issues with using technology, they can call, and then we just kind of connect them with one of our success reps, and they'll walk you through it. They'll literally go step by step until you understand it. And if there's something that's not working, we can kind of elevate the matter, and we can have somebody from our IT team look at it and see if it's something that needs to be fixed on our end.
Wonderful.
And just to build on those 2 points as a whole too, the country is changing quickly. There's more people coming in. There's more people aging, of course. The sprawl in terms of demographic is increasing. There's more people going rural and harder to access places. And the big thing, of course, that we all see is costs are rising, right? And that's the thing that's happening across the board. But the outcomes aren't changing, right? So you're paying more of everything, but you're not seeing any improvement. And that's sort of one of the things that we also really like to hit on is, we're giving you an improved service, and we're also able to service all of those more rural areas. So, if you are a senior who lives in cottage country, for example, right, it may be difficult to travel 40 kilometers to the town pharmacy. Well, now you don't necessarily have to. We work with marginalized communities as well. We work with indigenous communities, for example, up in the remote north. We're flying communities, for example, and we can service all of those people, and that's sort of the real fun part of being in a digital health world. You're able to sort of, as the country changes and as everything grows, we're able to sort of grow with it in that sense.
It's making it very inclusive, which I don't know, for a long time, you pick up your medications, they quickly run over them with you, you run away with them, but you're almost kind of missing a portion of information that you kind of need, or you get a pamphlet and it's like, if you have questions, you kind of have to keep running because the next person's behind you. Or I can't tell you how many times I've put a prescription in, went to go pick it up, and it's not ready for me, so I have to come back another time, and it all becomes a very time consuming process. And this takes that out entirely. So that's incredible. And it's incredible that communities are coming together and using this as well. And it's bringing a lot of different perspectives to a field that, again, like you said, was really untapped. So it's very interesting. And I was very thrilled to be able to speak with both of you today and kind of bring this to our audience. And I know this is definitely something that I'm going to be trying myself when we hang up here. But thank you both for coming on board and for talking with me. And is there anything that maybe you'd like to leave our audience with, or any tidbits that maybe we missed?
Yeah, I just want to actually touch on what David mentioned and what you said as well. The fact that you go to your pharmacy. One of the early questions that we were asked a lot was, well, if you're doing everything digital, are you not losing that person-to-person touch? And it was actually something that I thought about as well. I was like, you know what? Because I've always worked in a community setting before this, so I was like, you're not going to see them, in person. So, how are you going to make up for that? But I was actually pleasantly surprised to find out that the engagement is even higher because you have so many more resources to reach out to the pharmacy. It's not just a phone call. You know, you have our text-based app. You can send us a message on there. You can send text messages. You can send emails. You're getting the automatic prompts, and you're sharing the data back with us as well. And then one thing as well is, like you mentioned, you know, when you're in person, there is that time crunch. With us, the conversation's ongoing. It's not, here's your medication, that's it. You know, we do continual follow-ups. Patients can take the medication a day later, message us about it 2-3 days. The conversation keeps going. The pharmacy stays, you know, available to you essentially 24/7, 365.
That's really important to think about, because again, too, when you hear about like an online pharmacy, you're like, oh my gosh, but then you think about it, and the face-to-face interaction that you get at your local pharmacy is very cut and dry, very short. And like you said, this draws out the communication tenfold than what we've been normally getting. So that's incredible. But yeah, anything else that we want to touch base on?
Well,
bringing
I just want to just, you know, quickly speak to what you were just saying about equality and access to care, right? Like that is such a huge piece in Canada right now, especially because, you know, people suffer from, I mean, we all know that there's, you know, access to doctors is in, you know, dire straits. All sorts of levels of healthcare are really being strained right now. And there really is a significant part of it, which is, and I don't want to call it unequal access to care, but that's really what it is. You know, if you live in certain places, you simply don't have access. And that's sort of, you know, we go beyond what you would assume to be a traditional digital pharmacy with our other partnerships to provide access to that healthcare and completing that real circle of care. You know, there is, and certainly there was, probably still is, a certain stigma around online pharmacy. You know, people still think of like the back of the newspapers, and you have all those ads, and that's really not what it is anymore. It's, you know, we really are a digital healthcare solution, and it really does help provide that access to care across the board. And that's a hugely important piece as the country ages and as the population gets more spread out away from city centers. Having that access to care, staying on top of your medication, being able to get medication in a timely manner, all that stuff is really what's going to be the difference between, you know, a long and healthy life and a not so healthy and long life, maybe.
No, that's great. And yeah, I think that's one of the big takeaways I would hope people would take from this podcast is that, you know, we are kind of exhausting our current resources. Having an online system like this is actually, like you said, Harv, a tool in your toolbox, another tool in the toolbox, rather than something that is very daunting or scary. So I think that's very important to think about. And, you know, we do need more accessible systems going forward as, like you said, the aging population, like we're running out of resources in some aspects. So this is another thing that really, it is maybe daunting, but really once you get familiar with it, it would probably be very easy to use and take away a lot of stress that we really just don't know is there because we don't know any different at this point. So that's incredible. And thank you both for speaking on this and taking us into the world of Pillway. And I really hope our audience enjoyed this one. I really did. I was very thrilled to hear about this and to try it myself. So thank you both, Harv and David, for being here and for speaking on this and speaking very eloquently, by the way. So we really appreciate it. And if there's anything you want to leave with our viewers, that's great. But other than that, just thank you and have a great day.
Yeah, just thank you as well, giving us a platform to kind of get the message out there. I think as people find out about it, they learn that there is a better way, and you know, usually they're very optimistic once they find that out.
Perfect. I hope so too. As we move forward, we have to expand, right, and learn it a little bit more. So I hope everybody again can take that away from the conversation here. And I'm going to sign off now. Thank you both for coming on board. And again, have a great day.
You too. Take care.
You too.
Bye.